giovani malati, i giovani pazienti sono veramente al centro dell'esperienza clinica del Birmingham Children's Hospital in Gran Bretagna. Ci siamo fatti raccontare questa esperienza dal dottor Anthony Sinclair, che è il direttore della farmacia di questo ospedale pediatrico un po' speciale. Ne parliamo qui a Torino in occasione del 34esimo Congresso Nazionale della SIFO, dove appunto il dottor Sinclair ha tenuto un'importante relazione. Dr. Sinclair, you say that your hospital is patient-centric. In which way the pharmacist and the pharmacy is cooperating in this project?
We have a number of approaches. We've tried to listen to what patients want rather than look for our own priorities. So we have an outpatient pharmacy. So this is a pharmacy which is accessible for anyone who's not even in the hospital. They can come to it and they can ask advice about their medicines. We have special patient information leaflets which are designed specially for parents about their medicines. And
it is designed for the parents, but in which way? Which is the peculiarity?
When you open a pack of medicines, of drugs, there is an official information leaflet. And if you look at it, it can be very frightening for parents of children because it will say, don't give this to children because they're designed for adults. So the leaflets we have are designed to give all the information that is necessary for parents, but not have the bits that perhaps might worry them unnecessarily.
You also told us that the patient has not to wait too long for their drug. Please explain.
Yes, we've designed our processes and systems using technology and staffing numbers to ensure that when a patient comes to our special pharmacy, they wait no longer, on average, 11 minutes to get their medicine. They can also then spend as long as they want talking to a clinical pharmacist.
And the pharmacy is working together with the clinician for the assistance of the patient, or it stays in the pharmacy, so it's separate from the clinician?
No, in England we work very closely with doctors, and we have pharmacists on multidisciplinary teams. So when doctors discuss a patient, a pharmacist will be there and other colleagues as well. So we work very closely together.
Yes, but which is the role of the pharmacist? He help the clinician, he decide the drugs, and it's not the clinician who decide the drugs. Which is the real role of the pharmacist?
The doctor will diagnose what the problem is. The pharmacist will then work with them to select the correct drug, to work out how to give that drug. If it's a very young patient, this can be very difficult.
Because many drugs are off-label, no?
Because maybe 60% of drugs that we give to young children are not licensed for young children. They're off-label, they're unlicensed completely, and it's not clear how the safety profile lies and which ones you can mix with other ones. So the pharmacist is there to advise on this.
Last point, you said in your talk that in your hospital there is a lot of work for prepare young pharmacists to the future job.
It's a big temptation for existing managers like myself to just concentrate on getting through today. We should be really investing in the next generation. So in my hospital, in my department, we spend a lot of time investing in younger pharmacists. When I go to a senior meeting, I will bring a younger pharmacist with me. I will give some responsibility and see what happens. They can then try to do things knowing that they have the support of senior colleagues. And without it, we won't get to the future. We will just carry on with the past.
And do you accept Italian pharmacists in the Birmingham Children's Hospital?
I've recently have 2 Italian pharmacists from Molinette Hospital, and we're delighted to have colleagues from Italy. The English people, they adore Italians, so please come.